As we continue talking about breast Cancer Awareness Month is more than just wearing pink. It's about taking action by scheduling your mammogram, performing self-exams, and talking to your doctor about your concerns is also one of the most important things that one can do for early detection, and it can also help save your life. Joining us now with more conversations on this is Rolf Hansen, the CEO of the Cancer Association, and he is also an expert in breast cancer treatment as well as care. Mr. Hansen, good morning.
Good morning. Is it Apewa speaking?
Yes, it's Ndapewa speaking.
Apewa, lovely to hear from you, and welcome to all our listeners as well.
Thank you so much for making time to talk to us.
Thank you. It's a pleasure.
Right. We keep emphasizing and singing the chorus of October is Breast Cancer Awareness Month. Kindly just tell our viewers why raising awareness on breast cancer is vital.
So October is Breast Cancer Awareness, and there's a great misconception, everyone, that it is October's Cancer Month, and it's not. We actually celebrate and honor Cancer Awareness Month and Day during February, so February 4th, by chance also, unfortunately, the day that our late former president, Dr. Kage, he also passed away. But breast cancer is it's a huge challenge globally. It is the most diagnosed cancer globally. In low and middle income countries, especially in Africa, it is a serious killer. And heartbreakingly, in Namibia, it is also the most diagnosed cancer, and also the one where most Namibians are succumbing to a cancer diagnosis. So breast cancer really is a challenge. And especially in Namibia, we see that advanced breast cancer is a serious health concern. Advanced breast cancer basically means that our women are presenting too late. It is a stage 3B, higher 4 grade, and that makes the treatment very difficult. So curative treatment is a challenge, and then the outcomes are very poor. And then the cycle continues because then it feels the stigma. And then we all start talking about when you are diagnosed with cancer, it's a death sentence, you're just going to die. But the reality is, it is because we are diagnosing at a very late stage. That is why the treatment outcomes are so poor. So we need to change the narrative, turn it around, and promote and push the Pink October and breast cancer awareness so that women can be diagnosed way earlier and we can save lives.
Right. Now, what would you say are some of the early signs of breast cancer that women should look out for?
I think one of the first signs that any woman should look out for when doing a self-breast examination every month is suspicious lumps or growth in the breast. Not every lump is a cancerous tumor. It might be a fibroadenoma, but it's usually the lump that keeps on growing and is not painful. That is the difficult and challenging one. Those are the ones that we should be careful for. But still, all lumps in the breast should be reported and be investigated. Then what we've also seen is that breasts that are abnormally swelling, oblong, where the one is hanging way lower than the other one, where the nipple all of a sudden starts retracting. So you will see that the one nipple is inverted and the other breast is normal. That's a telltale sign. The skin of the breast changes, so like the shape or the discoloration even of an orange skin, so dimpled effect, scabby or scaly skin. And then obviously if there is superficial, abnormal hardening of the breast tissue. So if you have dense breast tissue already, you will see it when it becomes very, very hard, or when you have a small breast, ladies, you will see all of a sudden this breast is swelling up abnormally. That inflammation even that you think it's just the inflammation might actually be the lymph nodes flaring up and be a warning sign. So please look out for those. And then the last one is abnormal discharge. Now, women have got a mammary gland system in their breast, and you will have some fluid when the nipple is pinched, or you might have some discharge. But if it is a bloody or a pussy or a dark or a smelly discharge from the nipple, then it means that there's something wrong inside the breast and it needs to be investigated. We do have some breasts that are inflamed. There is such cases. And like I said, there are fibroadenomas, but all irregularities of the breast must preferably be reported to a healthcare professional or the Cancer Association or the Namibia Breast Clinic that we've recently established at various state hospitals throughout the country.
Right. What are some of the screening methods that are available in Namibia?
So, unfortunately, we are not yet, and it's not just us, it's low and middle income countries across the board, we're not yet on the WHO target of screening and diagnostics. The ideal is that for about every 300 to 500 inhabitants, there should be a mammogram unit with ultrasound kitted, readily accessible and available to the population. We haven't got that. So we recommend that the most efficient screening and diagnostic tool is for women, number one, to become 365 days a year breast aware, know your own breast, do a self-breast examination once a month, 7 to 10 days after your menstrual cycle. If you have already gone through your menopausal ages, note down a date and do that every month on that specific date. Do a self-examination once you've had your bath or your shower or you're just lying flat on your back in bed. Do a clinical breast examination at your local clinic or healthcare service once a year. The state has got breast clinic setups that we've put together in partnership, CAN and the Ministry of Health. It's called the Namibia Breast Clinic Program. And there's a referral point where the state clinic systems and referral systems can send you to these clinics, where there are also mammogram and ultrasound services available. The medical teams are trained to do examination and to do biopsies. If you are fortunate to have a medical aid or health insurance, please go for your annual mammogram and ultrasound with the relevant companies that provide this. And then the diagnostic tools in Namibia is obviously mammogram, ultrasound, together with a core biopsy. The Cancer Association currently funds this program together with Standard Bank Namibia, and we're helping the state system gear up and get this going. And women who have got the means or access to medical aids or financial insurance, please go and see your GP or a female health specialist and get these things done. Get your core biopsy if there is something wrong. And the most important thing is to be aware and to report. That's really the one thing that I want to reiterate. And ask for that biopsy to be done. Don't just accept that this is a mammogram or an ultrasound and everything is in order. If there is a suspicious lump or activity in the breast, ask for a core biopsy so that the histopathology can exclude or confirm immediately what is going on inside the breast, ladies, so that the treatment can start as early as possible.
Mr. Hansen, many people believe that breast cancer only affects older women, but who is at risk of getting breast cancer?
Oh, well, everyone. Dear fellow Namibians, even men too. Men get breast cancer as well. And I think the narrative has been for a very long time that it's white people that get cancer and only women that get cancer, or old people. Breast cancer is a serious health concern. Cancer is a serious health concern. We must always remember that skin pigmentation does not determine your biological and physiological makeup. The building blocks of the body, the cells, are all internally the same. We're all human beings. We're all unique. But also with that uniqueness comes the reality that sometimes there are DNA wobbles, whether it be hereditary. So with breast cancer, you might have inherited the BRCA1 or 2 genes. There might be lifestyle-related factors, either very early birth or no birth, estrogen, progesterone levels that are out of sync, and lifestyle, like I say. Obesity plays a critical role, alcohol consumption, tobacco use, stress even, all of these things trigger. So everyone should be wary, but especially women 40 years and older should take very, very care of their breasts and ensure that they do a self-examination, and especially if there is a family history. So we need to start asking these relevant questions in our families, and in African culture, we tend to shy away from those important discussions. Was there someone in our family who had this disease or that disease, or did grandma have cancer, breast cancer or whatever? And then we need to start noting these things down. Remaining oblivious and shying away from these realities is not going to keep the cancer away, but especially women 40 years and older need to start taking caution and heed that they are prone to breast cancer. And historically in Namibia, we have got a very high breast cancer incidence. In fact, in Southern Africa, we have got one of the highest per 100,000 incidence rates. For a small population, doesn't matter, we calculate it and compare it with per 100,000 population group in neighboring countries, and Namibia has actually got one of the highest. So women, please look after yourselves.
Most definitely. Your message is definitely heard loud and clear, Mr. Hansen. Thank you so much for joining us this morning.
Thank you very much. Keep well. Bye-bye.
Rolf Hansen, who is the CEO of the Cancer Association of Namibia, joining us this morning, just giving us an update, or basically talking to us about Breast Cancer Awareness Month, which is basically commemorated each and every October.